Hi, this is Eitan Shalom at the Body Mind Wellness Center, and I wanted to show you this interesting person's case that I'm doing dry needling with electrical stim on. And this is someone who came in with a psoas syndrome, so a very tightened psoas and IlioPsoas, which is the psoas and the iliacus. But in addition to that, he's a young man in his 20s. He had his appendix out and kind of like a sort of emergency bit of a surgery. Were you 12 years old?
Yeah, about 12.
Around 12. And he was affected by that ever since. And he had post-surgical pain. And so he's had a CAT scan and they've ruled out any kind of problem in terms of disease mechanism or infection causing his pain. But what Western medicine doesn't really look at is fascial adhesions. And fascial adhesions, which are well documented by Doctors Travell and Simons and lots of people since. Fascial adhesions can be a big source of pain, and one can develop fascial adhesions post-surgically as well. You can also get them, like for example, women will sometimes after surgery on the uterus, they have fascial adhesions that can be quite painful. Women that have had ovarian cysts treated or uterine fibroids. And so what I'm doing here, let me back the camera up a little bit, is I'm doing points, Chinese medicine points, like this point, which is point of that affects the liver qi, that one, and also the point on the there was a needle here in his wrist that I removed, and there's one on his other foot. Those are acupuncture points to open up the abdominal area. That's what's called the dye channel, to open up the dye channel. But specifically what I'm doing with electrical stim, I've moved some of the connections around since I first did them, was so there's a point here, there's a couple of points here right around where the appendix would be. And so that's where the fascial adhesions are. And I've been able to tell that by what he describes and also what I can feel when I palpate, when I press on his abdomen. So these 2 points are connected by electrical stim. These have been turned off now, so you don't see the moving. And then this point here, this is the motor point of the iliacus. So this affects the psoas as well. And these 2 points and that point are close to the area where his appendix removal was. He had it removed, what's the term for that? The kind of surgery?
Laparoscopic?
Laparoscopy. Otherwise, if he'd had it done 20 years ago, he'd have a big scar right here. And then we're also doing electrical stim from this point, which is on the linea alba, which also helps to release the fascia. And we're doing that with the iliacus point on this side. These points are more minor points, but they're supportive points. You can see the purple ink as I palpated and marked before I put the needles in. These were also areas of great tension. And so that's what I'm doing. And because I'm an acupuncturist, and because he was also able to describe a certain kind of congestion of the qi on the right side, it's interesting, the iliacus motor point is on the gallbladder channel, acupuncture channel, and he has headache pain on the gallbladder channel. So I've also done some points on his shoulder and the side of his head to open up the flow of qi in the gallbladder channel. And that fits perfectly with the rest of what I'm doing. And continuing down, I'm doing this point is called gallbladder 31 and gallbladder 34. These are acupuncture points, and then gallbladder 41. And these are points to open up the fascia, to release the fascia, that they have that effect of releasing fascial tension. And it just so happens that the area where his fascial tension is also the area where these points are. So that's all I wanted to show you. Thanks for tuning in.